Over the last few years, technological advancements have dramatically revolutionized diagnostics, making it faster, more accurate, and incredibly efficient. You have probably witnessed how healthcare technology has evolved from traditional medical tools to state of the art medical devices. Hello, everyone. Welcome to the Analytics Insight podcast, where we talk about the ever evolving tech space. And I'm your host, Priya Dialani. Tech integration in healthcare is a game changer. It's transforming from diagnostics to how patient care is delivered. The digital revolution is already here, reshaping the healthcare landscape and enhancing patient care. If you have ever wondered how innovations like AI, telemedicine, and other technologies are changing healthcare, this episode will give you more insights. Let's welcome Dr. Vikram Thaploo, CEO, Apollo TeleHealth, and Director and CEO of Apollo Telemedicine Networking Foundation. Hi, Vikram. A very warm welcome to our podcast today.
Hello, Priya. Thank you very much for having me here.
Great. So, Vikram, I think when we talk about healthcare, I think healthcare has been one of those industries that has always been at the forefront of, implementing these emerging technologies and enhancing the overall healthcare. And one such innovation, I would say, is telemedicine, which we are going to explore today from your end. But before that, let's give a brief understanding about, Apollo TeleHealth, what exactly is its specialization, and alongside that, a little bit more about you, Vikram. You can highlight probably your journey and, what is your role towards the Apollo TeleHealth today.
Okay, thanks, Priya. So, in short, Apollo Telehealth journey started around 25 years back when we did the first telemedicine center, set it up from Aragonda village to Apollo Hyderabad. That's when the journey of telemedicine started for Apollo. This was done by our chairman and Bill Clinton, who was a visiting president from US that time, in presence of Chandrababu Naidu, who was the chief minister of the state. So I think the journey started there. The world's first and the oldest multi-speciality telemedicine network foundation was laid then. And we played a pioneering role in healthcare delivery throughout the time. And we implemented large-scale public-private partnership. Over the years, the organization has touched more than 29 million lives. And we have delivered more than 25 million teleconsults, helping take quality healthcare closer to communities which would have otherwise remained underserved. So today's Apollo TeleHealth kind of operates in most states. We operate in 22 states, 700 plus centers, more phygital in nature. We are direct to customer as well as in a PPP mode. And also we right from the basic telemedicine at subcenters to covering digital dispensaries, primary healthcare centers, mobile medical units, teleophthalmology, tele-emergency, tele-ICU, screening for cancer and tuberculosis, integrated health centers, and full stack hospital management system. So this is basically what we do. My journey started with founding this Apollo TeleHealth in 2010. So since before that, it was only the foundation which was working for telemedicine in Apollo. And then we started telehealth as a for-profit but social, scalable, sustainable business model. So we have been working closely with governments, and as you said very clearly that these diagnostics have improved. So yes, connected care devices, connected health is right now what it is as we do go forward. And Priya, I was from the retail industry. I was from food and beverage industry. Then I went into FMCG, and in 2010 I shifted to retailing healthcare with Apollo. And multiple innovations have been done inside Apollo TeleHealth in the years, right from teleradiology to doing emergency to tele ECG and all of those services.
Thank you for that overview, Vikram. And we're really glad to understand about Apollo telehealth and the kind of impact it is driving on the society by integrating some innovative solutions and ensuring that they are being able to provide an accessible and inclusive healthcare in India today. Now, moving ahead, I think when we talk about Indian healthcare system, it is very diverse and a complex network of public and private sectors provide a wide range of medical services to India's around 1.4 billion inhabitants. Despite, significant changes over the year, the healthcare system continues to face multiple challenges. These include inadequate infrastructure or a shortage of healthcare professionals. Urban rural disparities is a long going challenge. and limited health insurance coverage. So a lot of these challenges are, leading to a fragmented healthcare system. How would you describe the current state of healthcare access in India, especially when comparing the urban and rural areas?
That's an interesting question, and I think that's where the need of telehealth is there. So technically, if you look at that Indian healthcare system, which has improved over the last few years, and I would say few decades now, the rural-urban divide is lessened, but it's quite significant even today. Urban centers usually have better access to hospitals, specialists, diagnostic facilities, pharmacies, digital infrastructure, and so on. In rural regions, however, the patients have to travel long distances, skip their daily earnings, and probably even after traveling, they would have access to a specialist care very intermittently. Though Government of India talks about doctor population ratio of 1 is to 811, which includes the Ayush doctors, which is better than the world WHO benchmark of 1 is to 1000. The real challenge actually lies in distribution because doctors today are concentrated in urban India, and 80% of the doctors are in urban area, catering to close to 35% of Indian population, while at 65% of the rural population remains behind in terms of access. So at the same time, if you look at the positive shift, though, which is happening through Indian digital innovations setup, digital health ecosystem is being supported by Ayushman Bharat, eSanjeevani, ABDM, which is the Ayushman Bharat digital mission. At the same time, if you look at telemedicine has become a very important bridge between urban medical expertise and rural healthcare needs. So if you, especially for primary consultations, follow-ups and specialist referrals, the need for actually is very urgent for more than 600 million people still live over 50 kilometers from specialist access. And non-communicable diseases such as diabetes, health, heart-related issues, cancer, they are causing close to 66% of burden for India in the disease burden. I believe the future of healthcare access will depend not only on the building of more hospitals, it will also depend on technology being connected and quality care getting closer to people.
A very important highlight, I would say, Vikram, because till today, I think healthcare access in India is deeply influenced by the geography and affordability, including the infrastructure developments as well. While the urban India is witnessing rapid advancements in healthcare, tech, and digital health services, many rural areas are still, struggling with limited medical infrastructure and, timely access to medical treatment. So, and I think, we are seeing certain encouraging progress, like you mentioned, with some of the government initiatives by mobile healthcare units or AI-driven diagnostics. So, and of course, telemedicine. So it's kind of helping bridge some of those gaps. With that being said, tech improvements have had a significant impact on healthcare and how it is delivered with, the increased use of outpatient day operations not involving an inpatient stay. Now, in a lot of countries, this is already leading to less dependency on large general hospitals and more focused on specialized outpatient facilities or clinics. And public-private partnerships, stand at the forefront of bridging the healthcare tech gap, serving as a testament to a collaborative potential in enhancing healthcare delivery across the globe. How do you think that these public private partnerships can play a meaningful role in scaling healthcare infrastructure and improving service delivery in India?
Very interesting aspect of it because if you look at PPPs, public-private partnerships, they are a very important, they have a meaningful role to play. If you look at it, the government technically brings the larger mass of public health priorities. It brings in policy support and access to large populations, whereas private organizations can bring technology, operational experience, clinical expertise, and the ability to implement these models at speed and scale. That's very important because speed and scale of implementing these models makes them actually important for people to access healthcare. So when both of the government and the private partners work together with clear accountability, healthcare services can be expanded faster in regions where building full-scale hospitals or specialist networks may not be possible immediately. So the impact of such partnerships is already visible. If you look at telemedicine hubs, digital dispensaries, teleradiology networks, e-clinics, mobile medical units, state-level primary healthcare programs, these models are actually helping reduce the burdens from tertiary care hospitals, as you said, support local health workers, and allow patients to receive timely consultations closer to their homes. So accessibility becomes very important. So as I earlier said, Apollo TeleHealth is working across 22 states with 700 odd centers with the PPP model to create sustainable and scalable healthcare system with the government. I believe in the long term, these collaborations can play a major role in preventive healthcare, early screening, remote diagnostics, emergency responses, and specialist access to the underserved populations. That's my take on it.
I agree with you, Vikram, that the collaboration between governments and private enterprises can help bridge certain critical gaps of infrastructure as well as digital health adoption and rural health accessibility. And like you mentioned, I think beyond the major developments, I think these collaborations can also play an important role in preventive healthcare models and enhancing the operational efficiency of the hospitals and reshaping the entire patient experience. Great. Now, when we talk about telehealth, Vikram, we have heard a lot of times that the internet has changed modern life. Indeed, it's likely changed, how you stay in touch with family and friends and even buy your goods and services. It's also probably even changed how you search for information about health problems. Several telehealth tools are offered to help you manage your healthcare and receive the services you need. I think during the COVID-19 pandemic, many people use telehealth and people often still use it. I believe. But how can you ensure that telehealth does not just ensure access, but it also gives the consistency and quality that is very much required in patient care?
Thanks, Priya, for that question. So I would start from the COVID times. Before COVID, it was very difficult for me as a telemedicine expert to explain to people why telemedicine is needed. So it was very difficult to explain to a doctor. It was equally difficult to explain to a patient. But during COVID, everybody understood the need for this contactless method of healthcare delivery. And if it is continuing today, it is continuing based on consistency and quality, not because it's needed today. In COVID, it was needed. Now it's not needed so immediately in the urban India, but urban India is using it quite easily because it's able to deliver consistency and quality. So it became truly valuable and goes, when it goes beyond one-time access and creates continuity of care, specifically for patients who are from the underserved regions. Healthcare has often depended on occasional medical camps, irregular visits, or delayed referrals. Right? Telehealth actually changes this by enabling structured access, and especially this structured access is required when you are dealing with chronic conditions such as diabetes, hypertension, respiratory issues, and cardiovascular diseases. And as I earlier said, 66% of India's disease burden is NCDs. So quality can be strengthened through standard clinical protocols, trained telehealth coordinators, electronic medical records, real-time collaboration between frontline workers and specialist doctors. If you look at the initiative which I just expressed a while ago, the Ayushman Bharat Digital Mission, which is actually showing the direction with the healthcare is going in India, 88.66 crore accounts have been opened for ABA. Close to 98.36 crore health records have already been linked. This kind of digital backbone can actually help doctors understand patients better, avoid fragmented treatment, avoid kind of improve the follow-ups. So I would say that for telehealth to deliver quality at scale, it must combine medical expertise, technology, data, security, clinical governance, and strong human interface.
Very well said, Vikram. And I think the real challenge today is not just accessibility to healthcare. It lies in ensuring the continuity and clinical quality across every patient interaction. And I think today telehealth is evolving from being just a convenience-driven service, which probably gained more limelight during COVID-19, but now it is becoming an integrated care ecosystem where it is combining AI driven monitoring or human expertise, medical expertise, digital health records, personalized engagement. So all of this when clubbed together are helping healthcare providers deliver more consistent and proactive care. And again, where you mentioned even policy and expertise, policy also plays an important role here with compliance to ensure a more reliable and patient-centric healthcare model for the future.
Certainly, I think a strong human interface, when I said,
Yeah.
it has to be human centric, which is patient centric as well. You keep patient at the center of healthcare delivery, then telehealth is not a replacement to regular healthcare delivery. It is just a method of delivering a service.
Yeah, yeah, true, true. And when we talk about access to healthcare, Vikram, I think, of course, with telehealth, we have come along a long way because, India has achieved a significant milestone in medical access for its citizens because it has surpassed the doctor population ratio of 1 is to 1,000, which is the WHO recommended standard. Yet, most doctors are concentrated in urban areas, and which kind of leaves the rural populations underserved. And the gap is sharper at the community level, with an 80% shortfall of specialists at community health centers, so which is resulting in delays in diagnosis and treatment. So, how do you think tech or telehealth can bridge the gap between the rural and urban healthcare systems, but in a sustainable way?
Yeah, certainly. As you said, the healthcare gap between rural and urban areas is still very visible. In cities, people usually have access to specialists, diagnostics, hospitals within a short distance. But in many remote areas, even basic consultation takes an entire day for a patient to go. So this is where actually technology can genuinely make a difference and has been making some difference in the past also. So telemedicine technically allows patients to connect with doctors faster while maintaining their digital records. And it can also do proper remote monitoring to ensure care doesn't stop after the first consultation. At the same time, if you look at technology, it makes healthcare easier. If it makes it easier and not complicated, a patient should not have to struggle with complicated apps, systems to speak to a doctor. The best digital healthcare models are usually the ones which work quietly in the background. And I think this is where we laid a lot of focus on. We work quietly in the background while local health workers and doctors continue to remain at the center of care. We are already seeing good examples through digital dispensaries where it's a paramedic driven model, teleconsultation centers, which is again a paramedic or a non paramedic driven model, to PHC, which is a doctor driven model. We have even experimented a lot with even drones, where we are using drones for healthcare in medicine delivery in difficult terrains. I think if we use correctly, technology can help reduce delays, improve continuity, and improve access to healthcare for all the patients, specifically in the rural areas.
Thank you, Vikram, for that overview. And, I think it is very important, especially at a time when access to quality healthcare still depends on geography. And I think with this, the idea of bringing medical expertise to remote, underserved communities through digital platforms is, I think, transforming the way healthcare is delivered. And beyond access, it's also creating opportunities for preventive healthcare and better patient outcomes. Yeah.
We usually say it in within our four walls that geography is history, and that's what telemedicine did. Geography is technically history, but it is the models which have to be implemented well.
Hmm. Right. So, Vikram, having said that, while we're talking about telemedicine and how it has emerged as a transformative aspect of healthcare delivery, I wanted to understand what are some of the biggest barriers to widespread adoption of telemedicine in India?
I think one of the biggest barriers is still the unfamiliarity with telemedicine. Before COVID-19, it was much more difficult, as I said, for us to explain it to the doctors and patients, which COVID pandemic actually changed a little bit. But someone who has always visited a doctor in person, kind of a video consultation looks very uncertain. Patients end up asking very simple questions. Will the doctor understand my problem? Will I get the right treatment? Can I trust the process? So along with these, I think there are practical issues still in our country: the internet connectivity, the digital literacy issue, the language barriers. I think a good trust builds with patients when you give them a good experience. If a patient can avoid unnecessary travel, speak to a quality doctor and a qualified doctor, receive proper follow-ups and proper support, I think they come again and use telemedicine. It's very interesting to note that I believe in our system we saw rural India is accepting telemedicine more open arms, with more open arms than the urban India, because once they get this good service, they stick to it. They don't question it after that. So community level stuff, community awareness, local health workers, healthcare coordinators, regional language support, all of this plays a role. I think over time adoption improves, not because people are forced to use technology, but because they see clear value in it.
Very true, Vikram. And this is very important because, and especially I think digital healthcare, it is no longer seen as an alternative today, but it has become such a critical extension of the healthcare ecosystem. And I think it is even more relevant with the Indian context because healthcare accessibility in India varies significantly between the urban and rural regions. And like you mentioned, some of the challenges, I think there are multiple layers that need to evolve simultaneously for telemedicine to truly scale nationwide. And I think perhaps the larger opportunity here is that I mean, we do have virtual consultations, but it's more about building a more connected and a patient-centric healthcare system for the future.
Certainly.
So, when you talk about telemedicine, and overall confidence in the healthcare system, so it has come to my notice that confidence in the healthcare system has decreased over time. In 2021, fewer than 4 in 10 adults, approximately 38%, said that they had a great deal of confidence. Inequities of care persist, with patients, that they don't have service to or access to healthcare. Lack of trust in healthcare remains an issue not just in India but also globally. So when I think of these trust along with the barriers from the social and structural determinants of health, it is clear how important it is to engage in authentic trust-based collaborations and ensure that we are having an equitable healthcare engagements. So, how do you think healthcare organizations can build trust and awareness among patients, especially in the rural and underserved communities?
Very valid question, Priya. I think in healthcare, trust is built through experience. And I also believe that it has to be built through transparency. If you look at telemedicine as an example, every telemedicine consultation is recorded. It is audited. We audit the doctors, how they consulted a patient, what are the clinical protocols followed, was the medication right. So if all of this is kind of in the notice of the patient, they would understand that it's not that a plain consult is given. It has a lot of layers where trust layers are built in. So audit layers are built in, quality care, quality check layers are built in, training layers are built in. So it's all for the best of the patient. So people may listen to advertisements or campaigns, but what really stays with them is when they feel supported, when they actually feel that they were taken care of when they needed the care. So in underserved communities, which I told you earlier also, the acceptance is much better, much faster, because when you provide them a good experience, they would stick to it. Someone has to guide them properly, answer their questions in their language, and stay connected even after the consultation. I think that's why the local engagement becomes extremely important. When healthcare workers speak to patients in their own language and explain things to them in a simple way, people become more comfortable. Small things often make a big difference. For example, if you help an elderly patient connect to a doctor over telemedicine for the first time, it creates confidence in the system. And we have seen it firsthand. We have seen it multiple times. As I said, with so many millions of consultations given, we have seen that patients do come back again and again. We have a good repeat patient base, give a good community service and good quality service. So once patients begin to see this digital healthcare can save their time, reduce their travel, provide quality healthcare, awareness naturally grows within the community itself. We run programs which are very connected to this. We run a program called SHE, which is social health education. And we have seen when we do those programs, people come back to these telehealth consultation centers time and again and are very well connected to the doctor. Many of the times, patients do remember doctors by name and ask for their doctors. So I think it's more or less trust-based system.
I agree with you, Vikram, and I think again, community engagement plays a huge role here. Or whether it's working closely with local healthcare workers, creating regional language awareness programs, or leveraging digital platforms in a very simple and inclusive way. Healthcare organizations, it's important for them to meet patients where they are instead of expecting patients to adapt to the system. And like you said, I think I agree with you that transparency is also very much important because patients today now want to understand how their data is being used, how decisions are being made, and whether these innovations genuinely improve outcomes for them and their families. And ultimately, trust is built over time through empathy and education and consistent patient experiences. And I think organizations that are able to prioritize these elements are far likely to create a more meaningful and long-term healthcare impact.
Certainly.
Great.
If you if I dovetail into it,
Mhm.
AI products, which are more like clinical decision support systems,
Yeah.
come with, let's say, hundreds of hours of doctor consultation and hundreds of years of doctor experience is rolled into one software.
Mm.
So a freshly passed out doctor is able to provide services and quality of care which is equivalent to maybe a doctor with 100 years of experience. So this is, I think, something which patients should understand and should be made aware of, that they are in safe hands, and technology usually plays a quality care role rather than anything else.
Right, I agree with you, Vikram. And with the kind of discussion we had, one last question for you is, how would a truly inclusive and accessible healthcare system would look like to you in India, probably in the coming years?
I think truly inclusive healthcare system is one where a person does not have to think twice before seeking a medical help. That's what you were referring to as confidence in the system. And also, they should not be thinking twice because of distance, affordability, or access. Right? Whether a patient lives in a small village or a city, they should feel confident that quality healthcare is within their reach. India has actually already taken a lot of steps in this direction and is coming up very strongly on the primary care as well as secondary and tertiary care. But I believe a healthcare system works best when it feels simple, connected, dependable, but from a patient's point of view. Technology, I think, will continue to play a major role, but healthcare should always remain, as we said, human at center. At the end of the day, people remember how easily they could access care and whether they felt genuinely looked after. And in India specifically, we have this very empathetic population. So when you feel connected with the doctor or a paramedic who's helping you do the consultation, you are connected with the system for times to come.
Definitely, Vikram. And technology has a potential to improve the quality of healthcare, and it can make it easier for more people to get healthcare facilities. And in many which way, I think telehealth offers ways to make healthcare more efficient, better coordinated, and closer to home. Thank you so much, Vikram, for taking all the time and effort to be on our podcast today and helping us understand that inclusive healthcare is not just a matter of providing medical treatment. It is about creating a healthcare system that respects the dignity and rights of every individual. It requires addressing the diverse needs of all people, including those who are vulnerable and marginalized, and ensuring that healthcare services are accessible, affordable, and culturally competent. Thank you for your insights, Dr. Vikram. It was pleasure talking to you.
Thank you, Priya. I think since my mission is making quality healthcare more accessible, equitable, and technology enabled, your podcast will help me reach out to people to make them understand that we are here to provide quality care and technology is here to provide continued care. Thank you.
Thank you so much, Vikram. This is for our listeners. I hope you enjoyed today's discussion around telemedicine, telehealth, and how inclusive healthcare can help build a healthier and a more equitable society where everyone has the opportunity to live a healthy and fulfilling life. Stay tuned for upcoming episodes, and you can view all our previous episodes on Spotify and other leading platforms. Thank you so much.